Welcome back, everybody. Dr. Brown from Brown Plastic Surgery. Let's talk today about the day in the life of a plastic surgeon. And I'm going to segregate that into a clinic day versus a surgery day and how that works for me. So let's start off with the clinic day. What's a day in the life like for me? Well, as you guys all know, I am very much into health and fitness. So usually, now during the times of COVID, I will get up and I have a whole garage set up. I'm a big CrossFitter. I love CrossFit. I enjoy it. So I usually will go down to my garage around 5 o'clock in the morning, do a little bit of stretching, and then I will follow the programming for my CrossFit gym and do a workout. And after I'm done with that, I usually go inside, spend a little time with my kids before they go to school. And a lot of times on my clinic day, I have time to drop them off at school because it's right around the corner from the house. So that's awesome for me. Hang out with my wife a little bit, get ready for work. And then once I drop my kids off to school, I come over to the office and we start clinic usually in my office around 9 o'clock. So I try to get here about 8:45 just to kind of set up in my office, get prepared for the day. My medical assistant and I will sit down and kind of go through everyone that's coming in for the day. We might have a minor procedure that day that we're gonna do. So we'll talk about the setup for that and how that's gonna go. And we just talk about maybe a patient's coming in who had some concerns as a follow-up. And I will also in the same time see new patients. So any typical day, I might see 6 or 8 follow-ups, sometimes more, and I will also see 4 to 8 new consultations for surgeries, be that reconstructive surgery for breast cancer or cosmetic procedures. So once clinic starts, we have a morning session and an afternoon session. So my MA and I kind of go back and forth in and out of rooms, seeing patients, doing what we need to do. And once the morning session is over, I'll break and have lunch around noon or so, and then we pick up the afternoon session. I usually book my last patient around 3:30 or 4 because I really want to finish up my notes before I go home. To me, it's always been very important that I finish all of my clinical charting before I go home so that that's not hanging over my head. So when I go home, I can just be focused on my family. So that's a typical day in the life for me in my clinic. Not too exciting, but that's our day. So my surgery day looks a little bit different. So let's talk about a day in the life in surgery. Most surgery centers will start procedures around 7:30 in the morning. So again, most days I'll get up and either go to my CrossFit gym and do a workout there, or on a surgery day, most likely I'll do it in my garage because I don't have as much time to get to the procedure versus to get to clinic. So on those days, I'll work out again, say hi to my family. This day is a little bit more rushed. I'm usually running upstairs to jump in the shower to get ready for surgery because I just don't have a lot of time to hang out after I work out. So once I do that, I'll head on over to the surgery center. When I get to the surgery center, usually the night before, I will sit down, take a look at the cases that I'm doing, mentally prepare for everything that's ahead of me. Are there any special things that I was thinking that I might need to do in a certain procedure? And once I get to the surgery center and I get all set up, the first thing I do is I grab this book. So this is a confidential weekly surgery book that I have my team put together for me. And what I have in here is everything that I need for surgery. I've got your medical clearance, so the EKGs, all the lab work that you might need. I've got before and afters, so we've talked about things for breast surgery and size, wish photos, everything that I need for you to do your case is in this book. So I bring this book with me, and this is really an important thing for me that I've developed in my practice over the years, because I used to get to the surgery center and the surgery center didn't have my history and physical, or they hadn't received something that they needed. So I had them make this book so that if they didn't have my history and physical, I could just hand them a copy of it. But more so, it's just a conglomeration of me organizing my day. So once I get to the surgery center, I'll go mark my first patient, and then usually, you guys know me, I love my social media, so I'll sit down, and for patients who've given me permission to show their case on Instagram or on any other social media platform, I'll prepare mostly on my Instagram, I'll tee up what I call the pregame show. So I'll go through my plan, I show pictures, I try to tell everyone what I'm gonna do in that case, and then I also shoot video in the operating room so that after the case, I can post the results before and after. So any typical day for me in surgery would look like this. Some days I'll have one big procedure that takes all day. So my mommy makeover procedures could be a breast augmentation with a breast lift, liposuction of the back and flank area. Now I use Vaser and it takes a little bit longer to do that. And then maybe a tummy tuck as well. And so some of those cases can be upwards of 6 to 7 hours. And that might be the only case I do in a day, or I may put on a breast augmentation, which is a quick 1 hour case. So that might be a typical day where I have one big operation. Another type of a day may be where I have 4 or 5 breast augmentations, and those are like an hour, about an hour to an hour and a half, depending on the case, sometimes less. And so I might do a bunch of those in a day. And so between cases, I'll eat really quickly, I'll prepare for the next case, do the pre-game show, do the post-game show, and I try typically to finish up all of my procedures by 5 p.m. So again, I'm real big on you make your lifestyle in medicine, you determine what it's gonna be like. So I try to be home as much as I can by 6 o'clock in the evening, and sometimes it's not until 7, but most of the time I'm finishing up before 5, getting my notes done and my dictations, and I get home by about 6 o'clock. So that is a typical day in the life of a plastic surgeon. I hope that that gives you some insight and gives you some inspiration if it's something that you want to do. Hey, if you guys have any other questions, you know you can always hit me up on any of my social medias, on Instagram at Dr. Richard J. Brown, or on TikTok at The Real TikTok Doc, and I will try to answer your questions whenever I get them. Have a great day, guys. See you next time.